Good morning. I am so delighted to have you here. You've clicked on the Let's Get Started button, so let's get started. Before we do that, let me just give you a quick introduction. I am a physical therapist. I've been a physical therapist for just short of 30 years, and I took my first PRI course in 2005, so that was 20 years ago. And PRI is why I'm still a physical therapist. It is why I opened my own practice. It is a brilliant and extremely effective approach to treating the human body. It works on your whole body alignment, movement patterns, systems. Anybody can learn it, and it helps all problems because your pelvis alignment is related to your hip pain and your knee pain and your ankle pain and your neck pain. And the position of your rib cage and the way you breathe affects literally everything in your body. And PRI starts there. And from there, we can manage your shoulder blade, get rid of that shoulder impingement, get rid of your hip impingement, cure your plantar fasciitis. So it is a brilliant whole body system, very effective, the most effective rehab system out there, period. And so I've divided this 4-week introduction course into 4 parts, and I do suggest taking it weekly, but you can go at your own pace. So week 1 is PRI. I'm going to show you 3 PRI exercises that nearly all of my patients need to do at some point in time. I'm going to show you them all. It's about a 15-20 minute daily program, and I want you to do that for the first week. Week 2 is walking. Walking is a very unique human skill, and it's really important for our bodies. Week 3 is sleep. We are so disrespectful to sleep in this country, and we are suffering for it. So we're going to talk about how to get a better night's rest. And then week 4 is the mind. And also, sadly, in this country, we have separated the mind and the body as though they were 2 separate things. That's not even possible. And we need to get back to integrating, connecting, and healing those things. So we're going to do that in week 4. So let's get started with some PRI. All right, I'm going to teach you 3 PRI exercises. The first one is called 90-90 hip lift, and it is the exercise that's going to reposition your pelvis. And then the second one is called modified all-fours belly lift, and that's the exercise that's going to engage your abdominal wall and release your spine. And then we start to get some feedback through the shoulders as well. Both of those are very gentle and very effective. The third one is called standing wall and chair supported squat. And there we're going to start to integrate an upright. We're going to get your quads active, but again, we're going to learn how to use your core properly, how to integrate the abdominal wall and your diaphragm and your pelvic floor into an upright exercise, which is where we need to learn to work and live. So let's go through them. All right, let's get started. We're going to start with supine 90-90 hip lift. And if you followed my YouTube channel or my blog, you've seen this exercise before. It is the most powerful alignment exercise, and it has been many years since I've met anyone who didn't need to do this exercise as a starting point because their pelvis is tipped forward, okay? So the pelvis tips forward, all right? As for many people, gravity, air pressure, malalignment, okay? Pelvis tips forward. What that does is it gives you lumbar compression, turns on your hip flexors, and importantly, turns off your abs. And this is why this is a foundational exercise, is we need to correct that. We need to set the stage for the rest of your recovery, including being able to integrate your abdominal wall properly. So let's start by moving the pelvis. You're going to want to lay on a firm surface and have your feet up on a wall. If you're having a hard time finding your hamstrings, often we'll put a little box or shelf there for people so that they can find those hamstrings better, okay? About 90 degrees of the hips and the knees, okay? You're going to take a breath in through your nose. As you exhale, you're going to raise that pelvis up, just the pelvis. So I just moved my knees towards the ceiling. My low back is still on the ground. And what I'm doing with my feet is I'm pretending there's a shelf there. There's not, but I'm pretending. And I'm gently pulling my heels down so that I can get my hamstrings, the muscle in the back of the thigh, on. quads on. I definitely don't want the hip flexors on. I don't want those calves on either, just the hamstrings, okay? And then after 4 long breaths, we're gonna slowly lower back down, okay? Let's do that together. Take a breath in through your nose, out through your mouth. Knees up, pelvis up. 4 more long breaths. In through your nose, out through your mouth. Let those ribs come all the way down. In through the nose, out through the mouth. In through the nose, out through the mouth. And on that last inhale, lower back down. I hope you guys can hear those squirrels chatter like I can, because they are having a good time out there today. Let's do that again. I will just remind you, with all of your exercises, any exercise in PRI, you should not have pain. You should not have pain in any PT exercise, by the way, but I will speak for PRI because that is what I do full time. No pain. This is not a no pain, no gain situation. It never is in the body, okay? So no pain. Take a breath in through your nose. Exhale. Knees up, pelvis up. In through your nose, out through your mouth. Now we're going to add what we call reference centers, which are neurologically active centers in our body that really help our brain and our body connect to each other again and restore new patterns, symmetrical patterns, which is what we're after. So now I want you to think about feeling your right arch on the wall and the inside of your left heel, okay? Same hamstring pull, same breathing pattern. In through the nose, out through the mouth. Exhale a little longer than inhale. Right arch, inside left heel. Let's do that again. In through your nose, out through your mouth. Ribs down, belly active. One more, in through the nose. You should definitely be able to feel your hamstrings by now. Make sure your neck is relaxed. Make sure your back is relaxed. This is an alignment exercise. We're not doing strength training. We are realigning and connecting to, realigning your pelvis and connecting to your hamstrings. In through that nose, out through the mouth. Long exhale, right arch, left heel, and then inhale, lower down. Great. Okay, so that's 90-90 hip lift. You're gonna do that exercise about 5 breaths, right? 4 to 5 breaths, 4 repetitions, and you're gonna do that every morning, okay? Do that for the next 4 weeks. Set your stage every morning with good alignment and a normal breathing pattern, okay? Now, you've also seen, probably on my YouTube channel and on my blog, that there are more advanced versions of this exercise, including a right reach and a balloon and a left shift. When you feel ready, especially after 30 days, probably for most of you, when you feel ready to move on to those more advanced exercises, please do, okay? One of the things I really want to empower you with is you are in charge of your body. You know your body. I'm here to guide you. You may not have all the answers, but you need to be listening to your body. And when it says, you know, we're ready for more, please go do more. If it says, you know what, we need to stay with this exercise for a while longer, it's helping, I feel better, I have less pain, then just keep doing it. Again, it's your body, you're in charge, okay? All right, so stay tuned for the next one. We're gonna move on to all fours belly lift. All right, here we are with our second exercise in the beginner series called Modified All Fours Belly Lift. Here's an exercise where we're going to learn to engage the abdominal wall Release the back. If you have any back problems, this is going to feel great. If you have any incontinence, pelvic floor pain, feel like your abs are weak, this exercise is going to feel great. It's really the reset button for the core, and learning, again, really importantly, to use the diaphragm, the pelvic floor, and the abdominal wall together as a unit. Those three groups of muscles work together to pump air, manage digestion, manage if we're having any incontinence, constipation, they're really important there. Also, the diaphragm with the abdominal wall and the pelvic floor moves our cerebral spinal fluid. So if there is one system that's going a little wacky in your body, and if you have chronic pain and chronic fatigue, it sure is, but also for many people, this is a problem, and it is easy to fix. So we're going to do it here with this exercise. So we're going to again find a firm surface. This one could be on the bed. Sometimes it's a little soft on the wrists, but go ahead and try it. That's the best option for you. We're going to come here to hands and knees. And in the hands and knees position, you're just going to maximally round your back, okay? And I've basically got my shoulders and my wrists and my hips and my knees stacked up on top of each other, okay? Now, as I exhale, I'm doing that push up, okay? And now I'm going to push my left arm down a little bit more, and then I'm going to pick it up, and I'm just going to let it bend right there. What that's going to do is that's going to engage my internal oblique. And we're going to stay here for up to 4 breaths and let that internal oblique and that diaphragm and that pelvic floor and that transverse abdominis learn to work together. You don't have to push that hard. This is not that hard of an exercise, right? Like, I'm not trying to engage every muscle in my body, right? I'm just in a nicely rounded position, 4 breaths, right? Now I'm going to put that arm back down. I'm going to go to the other side again. I'm going to push my right arm down, pick it up, engage that internal oblique, take 4 breaths. Now we get the tricep working, we get the serratus anterior working, we get that abdominal wall, diaphragm, and pelvic floor. I want you to notice your pelvic floor working together. So as we exhale, belly comes up, pelvic floor lifts. In through the nose, breathe into your mid-back. Exhale, belly up, pelvic floor up. Inhale into the mid-back. Exhale, lift. As you exhale, we're going to switch. I'm going to push my left hand down, pick it back up, engage that oblique. I'm going to hang out here 4 more breaths. My back is rounded. I've got a nice straight elbow on my opposite arm, tricep and serratus. And then listen to your core. In through the nose. My back is rounded, out through the mouth. Core. In through the nose. Out through the mouth. Belly's up and in. Pelvic floor is up and in. Great. We're going to switch one more time. Put that hand down. Push with your right hand. Again, I'm going to just re-round there a little bit. Exhale. Belly up. Pelvic floor up. Breathe into your mid-back. Exhale. Notice your core. What's happening in there? What would I like to have happen in there? Am I pushing out? Am I not lifting my belly? Am I pushing through my pelvic floor? Am I holding my neck too tight? Am I not letting my rib cage move? Notice your body, okay? Pay attention, feel it. Again, it's yours. Great. Are you feeling your back? If you're feeling your back, you know what? Just put that hand back down and spend a few breaths right here. There's my triceps. There's my serratus. Oh, I can feel how to breathe into my back. Yeah, exhale. Core. Should feel really good. Okay? So again, that's when we're going to do 4 breaths 4 times. Again, on my YouTube channel, on my blog, you're going to notice a number of other versions of the all fours work. There's the posterior mediastinum work. If all fours belly lift is too difficult for you, start with the posterior mediastinum work. If this is too easy for you, move on to belly lift walk. Okay, so again, we've got a lot of room here, but I would say for the average patient that I'm starting with, this is the right starting position. But again, you got to listen to your body. If you need something more or less, there are resources out there, including on my YouTube channel and the rest of my blog. So go and investigate a little bit. See if there's an abdominal and core exercise that feels like it's better for you, okay? All right, once you master all fours and we feel like, ooh, this guy's pumping together, right? Then we're gonna move into a standing position because we wanna be able to integrate that into standing and then start to get these nice quad muscles, which are our mobility muscles, working again. So let's do an exercise in standing. Okay, here we go. We are doing the wall and chair supported internal oblique and transverse abdominis exercise. You're gonna find yourself with your back on a wall or a door. You're gonna move your feet 8 to 10 inches away from the wall. If you're short, maybe 7, or maybe if you have knee pain, maybe 7. So again, somewhere between 7 and 10 inches. Put a ball or a towel between your knees, okay? And then place your hands on a chair in front of you, okay? When I do that, I'm keeping my back rounded. You'll see I've bent my knees till they're just at the ankle, and my back is maximally rounded, okay? Now we're gonna do some breathing here, okay? So take a breath into your nose, exhale. When I exhale, I'm actually pressing into this chair, and what you're gonna feel is that your abs are gonna engage. Now, if what you feel instead is your hip flexor, relax those legs a little bit, maybe even move back up the wall a little bit, bring the chair back a little bit. Okay, find that spot where you're like, okay, yes, my abs are on. Okay, let's do that again. Now when I inhale, I'm gonna breathe into my mid-back. Right, see that? I'm moving my rib cage towards the wall. I'm expanding my posterior mediastinum. Again, when I exhale, I'm gently pressing into the chair. Inhale, expand into the mid-back. Exhale, press into the chair. The ball is there between the legs. You might notice a little bit of adductor, but mostly we're after this medial quad right here. So just, again, and analyze those feet. Our weight mostly on my heels. And then after you practice this for a while, then we can go back to those reference centers of the right arch and the left heel. Okay, so let's take another breath into our mid-back. Exhale. Quads and abs. Just listen to the core. Yep, good. Now, on this next exhale, your quads might be getting a little tired. On this next exhale, we're just gonna slide those hips back up the wall. But you'll see how I kept my back rounded as I did that, okay? Give those quads a little bit of a break. And then we do it again. Exhale. I'm bending my knees. My low back is on the wall. Yep. Again, I could have more of my back on the wall. I could come back further, okay? That would work just as well, right? You got to find the spot that works for you, okay? Breath in through your nose. Exhale. I'm going to press into the chair. I'm going to feel my hands and my heels. Yep. Into the mid-back. Exhale, push. What do you feel? Oh, I had to relax those hip flexors a little bit. There are my quads and my abs. Very good. One more, into the mid-back. Exhale, hands and heels. Very good. On this last exhale, Slide those hips up the wall, keeping the back rounded, right? You're learning to have more abdominal and quad control there. Okay, great, nicely done. Okay, gonna do that 4 times. 4 breaths 4 times, and again, let's do that every day for the next 30 days, okay? And then we're gonna have a really good base for the quads, the abs, and the pelvic floor. Now again, if this exercise feels like it's too easy, check out my YouTube channel and the rest of the blog. You're gonna find exercises like unresisted forward reach, resisted forward reach. Those are more challenging. Standing balloon with internal rotation, right? There's plenty of options to progress this exercise. But I find for most of my patients, this is where we need to start in the standing wall and chair exercise so that we can do the learning first of what do my abs do, what does my diaphragm do, what does my pelvic floor do, and how do I do that with quads and not hip flexors. All right, great. You be well. Now you've got 3 exercises here. We've got 90-90, we've got all 4s, and we've got this standing exercises. So again, that should be about a 15 to 20 minute exercise program. Each exercise should only take about 5 minutes. Do it every morning. Nobody does their exercises at the end of the day. Well, I won't say nobody, but most people don't, right? Like if you don't dedicate time for yourself in the morning, it's gonna be really hard to do it later in the day. So give yourself that 15-20 minutes at the start of the day, get those exercises in, do them every day for 30 days. And then again, listen to your body. When am I ready to progress? When do I need help, right? If you're struggling and this is not working for you, please reach out, email, give me a call. We can work on this together, and sometimes we just need that. But if these feel good, do them for 30 days, progress them as you're able to. And again, lots of resources on my YouTube channel and my blog to help with the progression as well. All right, you be well. Take care.